Start. Welcome back guys. Now let's discuss about the topic of FEV1 by FVC ratios. Okay. So the topic that we are starting, FEV1 by FVC. Okay, FEV1 by FVC ratios, and why we have to know this FEV1 by FVC ratios is because to identify the obstructive lung disease from restrictive lung diseases. Now, first basic thing, sir, what exactly is this FEV1 and what exactly is this FVC? Okay, what is FEV1, what is FVC, and what is the ratio and how it is helpful for us in differentiating the obstructive pattern from the restrictive pattern. Okay, now first let me explain you what is normal. Okay, step by step I will explain. Guys, what is given on the x-axis? Always the golden rule. First check what is given on the x-axis. On the x-axis we are talking about the time component. We are talking about just time. How many seconds? Time in seconds. 1 second, 2, 3, 4, 5, 6, 7, something like that. Okay, time. On the y-axis we are talking about how many liters of air is coming out. Okay, 1 liter, 2 liter, 5 liters, 6 liters. So basically here we are all talking about the expiration, not about the inspiration. Only we are talking about the expiration. Okay, expiration versus time. Expiration versus time. So in how much time, how much expiration is happening. Now let's say a healthy individual. Imagine I am a healthy individual, guys. In a healthy individual, I am asking him to do the expiration. Okay, I am asking our healthy individual to do the expiration. Now look at me. I am doing the expiration, right? That too I am doing it forcefully, not normal. I am doing it forcefully. For how much time I am doing the expiration? Look, I am doing the expiration for something like that. Okay, 5 seconds, 6 seconds, something like that. I am doing the expiration for 5 seconds or 6 seconds. So okay, let's say a normal individual is doing expiration for how many seconds? Okay sir, 5 seconds he is doing. Okay, 5 seconds. In this 5 seconds, how much air he has taken out? Okay, for example, how much air he has taken out, the maximum air that he is taking out, let's say 5 liters of air. Okay, 5 liters of air. Okay, so he is doing the expiration for how many seconds? 5 seconds. In this 5 seconds, how much air came out? 5 liters. Usually 4.7 liters will come out. That's the vital capacity, the maximum air that you can take out of the lungs. But for round figure understanding purpose, let's understand. See, he is doing the expiration for 5 seconds. In this 5 seconds, how much air he has taken out? He has taken out a air of 5 liters. Okay, 5 liters. In 5 seconds, 5 liters air come out. So this is called as forced, means forcefully you are taking out the vital capacity, means the maximum air that you are taking out of the lungs. The maximum air that you are taking out of the lungs, that's the forced vital capacity. And how much is that? Round figure value, let's say 5 liters. Now, one thing completed. Forced vital capacity is the maximum air that you are taking out of the lungs forcefully. Okay, and how much is that? Doesn't matter. 5 seconds, 6 seconds, time doesn't matter. How much finally, how much air you have taken out? 5 liters. Okay, fine. Now, look at the first second. Okay, look what is happening in the first second. See, in the first second, how much air has taken, he took out of his lungs? Almost 4 liters. Out of 5 liters, see, out of 5 liters, he is taking out 5 liters of air in 5 seconds. But just within 1 second, in the starting first second itself, he is taking out how many liters of air? 4 liters of air is coming out. So this 4 liters of air, this is called as a FEV1, that is forced expiratory volume only in 1 second. How much is coming out? 4 liters is coming out. So now we are done with the two things. What is FVC? 5 liters. What is the FEV1? That is the forced expiratory volume in first second. In the first second is 4. So now tell me what is FEV1 by FVC ratio? Sir, FEV1 by FVC ratio, that is 4 liters is coming out of 5 liters. Out of 5 liters, 4 liters is coming out within 1 second. So how much will be the value? 80% or 0.8? 80% or 0.8. So what I am trying to say, in a healthy individual, guys, so this is all about the healthy individual. Okay, this is all about healthy individual. So in a healthy individual, okay, if he is taking out 5 liters of air, almost 80% will come out within 1 second. If I wish, 80% of the air is coming out just within 1 second. So I am having that much capacity, okay, to take 80% of the air out of the lung within 1 second. Okay, so done. Normal FEV1 by FVC ratio is 80% or 0.8. Now let's see what happens with the obstructive lung disease patient. Okay, here anyway normal is given. See, this blue color curve is a normal, which you already know. Now I am talking about the patient who is suffering with the obstructive lung disease, the smoker fellow. Okay, smoker are the one who is having emphysema. Okay, obstructive lung disease. See, when I ask him to do the expiration, okay, see, forcefully with lot of effort, he is also trying to take the air out. Maybe he will be doing it for, let's say, 6 seconds, 7 seconds or 8 seconds. But at the end of the day, he is also taking out, see, a normal person is taking out how many liters of air? 5 liters of air. Almost this obstructive fellow also, this patient with emphysema also almost he is taking out 5 liters of air, almost near or slightly decrease. Okay, but for now we are saying in obstructive lung disease patient with forceful expiration, he is taking out almost 5 liters of air. Now students will start to confuse. But sir, you have told us that obstructive lung disease patient, emphysema patient, they are having expiratory problem. They cannot do the expiration normally. Yes, where is the difference? How can I be equivalent to a smoker guy? I am a healthy individual. My FVC is 5 liters and a smoker guy FVC is also 5 liters. Yes, but where is the difference? The difference is not about the FVC. The difference is FEV₁ value. Look at the normal FEV₁. In a normal individual, how many liters is coming out? In 1 second, let's say 4 liters of air is coming out. But a patient with obstructive lung disease, can he take out air easily? No, within 1 second, only 1.5 liters of air is coming out. So what is the difference between you and a smoker? The difference between you and smoker is not the FVC, the difference is in the FEV₁. Your FEV₁ is 4 liters, but his FEV₁ is only 1.5 liters. So what happened to FEV₁ value? Reduced, FEV₁ value reduced. FVC is almost normal. Sometimes FVC can also decrease, no doubt, FVC can also decrease. But most of the times in books they say, FVC is almost okay. But the main difference is FEV₁. So now write what is the FEV₁ value in this condition? Sir, FEV₁ on 1.5 liters. And what is the FVC? Near to normal, sir, 5 liters. So definitely FEV₁ by FVC ratio definitely is less than 0.8 without any doubt. Normally 0.8. But if the value goes less than 0.7, so 1.5 divided by 5, definitely the value will be less than 0.7. If the value is coming less than 0.7, it is diagnostic. Yes sir, this patient is suffering with, it's diagnostic for what? Obstructive lung disease. So now tell me how to put the diagnosis of obstructive lung disease. If a patient's FEV₁ by FVC value, if it is coming less than 0.7, done. Okay, he is having obstructive lung disease. Okay. Next, okay, that's the reason why here I have written, see FVC, most of the time it is normal or sometimes even it can be reduced. So never ever say that whether the patient is having obstructive lung disease or restrictive lung disease based on the FVC, no. Based on the FEV₁, no. We have to always, this is the golden point, always calculate FEV₁ by FVC. If the value is less than 0.7, obstructive lung disease. Don't simply say, sir, FVC decreased or FEV₁ decreased, so obstructive lung disease, never say something like that. Okay, next up, let's see the third case. Here we are discussing about the restrictive lung disease patient. See, normal completed, we know normal. Then this green color fellow, who is the green color fellow? Obstructive lung disease. Now we are going to discuss about the RLD patient. Now you tell me, in RLD, restrictive lung disease, the lungs are small size, small lungs, inspiratory problem, so he is taking less air into the lungs. If he is taking less air into the lungs, automatically less is coming out, less goes in, so less comes out. Simple logic, no? Less goes in, less comes out. So now look what happens to his forced vital capacity. Sir, he is also expiring for 5 seconds, okay? For 5 seconds he is doing the expiration. How much air he has taken out? Sir, he is taking out only 3 liters of air. Why 3 liters of air? Less goes in, less comes out. So, how much maximum air he is taking out of the lungs? Okay sir, 3 liters. So, FVC. What happened to the FVC value in this condition? Sir, FVC value 3 liters. Is it reduced or not? Yes, definitely reduced, sir. Normal FVC is 5 liters, but in this condition FVC reduced. Now, let's look at the FEV₁. Guys, in this condition, the FEV₁, let's look at the FEV₁. Normal FEV₁ is 4 liters. But in this condition, what happened to the FEV₁ value? Let's say 2.5 liters in this condition. So, yes, FEV₁ also reduced as well as FVC also reduced. Both FVC as well as FEV₁ both are reduced. Now, FEV₁ in this condition, let's say it is 2.5 liters. Okay, 2.5 liters. Now, both are reduced. Now, if I calculate FEV₁ by FVC ratio, FEV₁ by FVC ratio, how much is that? That is 2.5 liters divided by 3 liters. Out of 3 liters, 2.5 is coming out within 1 second. So, definitely the value will be somewhere around 0.8 or slightly even it is more, 0.85 something like that. Okay. So, what I am trying to say, in a patient with restrictive lung disease, FVC is reduced, FEV₁ also reduced, both are reduced. FVC is reduced as well as FEV₁ is reduced. But what happened to the FEV₁ by FVC ratios? The FEV₁ by FVC ratio is near to normal or even slightly increased. Okay. Now, students will start to confuse, sir, how the FEV₁ by FVC ratio increases? Let me ask you. See, students, answer this. 5 divided by 10, how much? 0.5. 2.5 divided by 5, how much? Then also 0.5. The fraction is going to be same. Okay. So, if you decrease the numerator as well as the denominator, decrease the numerator and denominator in the same proportion, the fraction will be the same. The answer will be the same. Here this is what is happening in the restrictive lung disease patient. In a patient with restrictive lung disease, both FVC decrease as well as FEV₁ decrease. Okay, the forced vital capacity, the FVC as well as FEV₁ both are decreased in a proportion. So the ratio will be normal. Or slightly increased. So now you understand. So what is the difference between obstructive lung disease and restrictive lung disease? In a patient with obstructive lung disease, the FEV1 by FVC ratio is less than 0.7. In a patient with a restrictive lung disease, the FEV1 by FVC ratio is normal or even slightly increased. So how the question is going to show up in your exam? They will give you this graph, okay, and they will ask, what is this green color curve representing, and what is this blue color, and what is this orange color curve? So tell me, this green color patient, is he suffering with any disease? Okay, this green color subject, let's say, is he suffering with any disease? No, this is normal. We all know the green color is normal. Okay, he's a normal guy. Okay, then what about the blue color? What about the blue color curve? So now this blue color curve, he is a person suffering with obstructive lung disease. And what about this orange color curve? So this is the person who is suffering with restrictive lung disease. We all know. Okay, because in restrictive lung disease, see, FVC is decreased as well as FEV1 will also be decreased. Definitely FEV1 will also be decreased. Okay, so now let's look at the summary. Tell me whether this statement is true or false. In a restrictive lung disease, both FVC as well as FEV1 are reduced, but proportionately, both are reduced proportionately. So FEV1 by FVC ratio is normal, yes, or even slightly increased. Tell me, in a normal lung, what is the FEV1 by FVC ratio? 0.8. Okay. Tell me, what is the disease in which the FEV1 by FVC ratio decreases? That too, less than 0.7. Less than 0.7, what is the disease? Okay, obstructive lung disease. And I have told you, in restrictive lung diseases, the FEV1 by FVC ratio will be normal or slightly increased. For better clarity, for better understanding, again I will repeat this. See guys, here, the difference between obstructive versus restrictive. Now first look at the obstructive. Have I told you, in obstructive lung disease, the FVC will be normal. And what about the FEV1? FEV1 is reduced. So FEV1 by FVC ratio is definitely reduced. And how much reduced? Less than 0.7. Then what about the restrictive? In restrictive, both are reduced, but proportionately. Both are reduced, but proportionately. So FEV1 by FVC ratio will be normal or slightly increased. Normal or slightly increased. Okay. Next up, how the question is going to come up in your exam? See, they might give you these three curves. Okay, they might give you these three curves. And what we are discussing, see, on x-axis we are talking about the time. Okay, how many seconds? And on y-axis we are talking about the volume. Okay, little different. See, in a normal individual, let's say this is the normal FVC. Okay, so here this guy, here is the normal FVC. Let's say this guy is taking out, he is doing the expiration for how much time? 4 seconds. 4 seconds. In the 4 seconds, okay, how much air he is taking out? Sir, he is taking out 5 liters. You can very clearly see from 0 to 5 liters. So 5 liters of air is coming out. The normal FVC in this guy, the normal FVC is 5 liters in this guy. Okay, 5 liters. And what about the FEV1 means in 1 second? In 1 second, see the first second. In first second, how much air is coming out? Sir, 4 liters is coming out. So FEV1 is 4 liters. Okay. So what is the FEV1 by FVC ratio? 4 divided by 5, 80%. Normal, we know. But look at the obstructive lung disease patient. See, in obstructive lung disease patient, I have told you the FVC will be normal, or sometimes even it is reduced. Even it can be reduced. Okay. So yes, here that's what I am showing you in obstructive lung disease. So see, here he is doing the expiration for, let's say, 9 seconds. Obstructive lung disease, no. So yes, he can do the expiration for a lot of time. Maybe not 5 seconds, maybe 6 seconds, 7 seconds, or 8 seconds. And that too I am telling you, in obstructive lung disease, yeah, the FVC can decrease. Okay. So yes, decreasing. How many liters he is taking out? Let's say he is only taking out 3 liters. Okay, 3 liters is coming out. His FVC is how much? 3 liters. Okay, sir, FVC is 3 liters. And what happened to FEV1? Sir, FEV1 is only, let's say, 1 liter or 1.2 liter. So FEV1 reduced. So FVC reduced, FEV1 reduced, but not proportionately. Definitely not proportionately. Okay. So FVC reduced less, FEV1 reduced less, but not proportionately. So if you do the FEV1 by FVC, that's 1.2 liters divided by 3 liters. So now what is the FEV1 by FVC ratio? 0.4 or 40%. So yes, if the value is less than 0.7, if the value is less than 0.7, without a doubt, it is obstructive lung disease. Okay. So why I am stressing on this point is because, see, students will only have this one point in mind. Sir told us in obstructive lung diseases, always the FVC will be normal. No, not necessarily. Here I have told you, yes, in obstructive lung disease, yes, FVC, yeah, can be normal or even reduced. It can be reduced. That's what I am showing you here. So in obstructive lung disease, yes, here in this condition, FEC is reduced, only 3 liters. And what about the FEV₁? Also reduced, but not proportionately. Both are reduced, but not proportionately. So yes, this is obstructive lung pattern, obstructive lung disease pattern. Now look at the restrictive lung disease. Sir, in the restrictive lung disease, look what is happening to the FVC. Sir, FVC is how much? 3 liters. Reduced. Normal is 5 liters. Here it is 3 liters only. Okay, reduced. And what about the FEV₁, sir? FEV₁ is 2.5 liters or 2.7 liters, let's say, in this condition. So, okay, both FVC, FEV₁ both are reduced. In a normal individual, FVC is 5 liters, FEV₁ is somewhere around 4 liters. But in this condition, FVC is reduced as well as FEV₁, both are reduced. But proportionately, both are decreasing. So, what is happening here? So, FEV₁ by FVC ratio, see, it's even 90%, that's a 0.9, it's even increased, so slightly increased. So, this is how to differentiate between obstructive versus restrictive lung diseases. If you know this, no one can stop you. Always to say whether the patient is suffering with the obstructive or restrictive pattern, don't just check FEV₁ by FVCs. Because look, in both the diseases, in both the obstructive diseases as well as restrictive diseases, see, FVC decreased, FEV₁ decreased, FVC decreased, FEV₁ decreased. In both the conditions, FVC, FEV₁ are decreasing. But the ratios are important. Based on the ratios we are going to diagnose. Okay. So with this, successfully what we have completed, FEV₁ by FVC ratios topic completed. Now let's look at the MCQs. Okay, let's look at the MCQs for better understanding. Guys, a 60-year-old male, okay, present with a complaint of dyspnea. He is having difficulty in the breathing. Previous medical history suggests he is having emphysema. Stop. The moment you see the word emphysema, we all know emphysema, obstructive lung disease. Okay, so emphysema, sir, OLD, obstructive lung disease. What changes in the pulmonary function test is expected in him? What changes in the PFTs can be expected in him? What do you think? In obstructive lung diseases, FEV₁ by FVC ratios increases? No, FEV₁ by FVC ratio not increases, they will decrease. Yes, there is decrease in FEV₁ by FVC. How much decrease? Less than 0.7. Less than 0.7. Next, air remaining in lung. So this is a topic from the lung volumes and capacities. But anyway, air remaining in the lung after normal expiration. How much air is left over in the lung after normal quiet expiration? Most of the students will start to answer it as RV. No. After normal expiration, air remaining in the lung. Let's look at this diagram, guys. Guys, here look at this. Have I taught you? After normal quiet expiration, this is the quiet expiratory point. After quiet expiration, how much air is left over in the lung? That is functional residual capacity. Never answer it as a residual volume. The examiner will try to confuse you. But when the answer will be residual volume? After forceful expiration. See, after forceful expiration, what is the air that is left over in the lung? Residual volume. But after quiet expiration, what is the air that is left over in the lung? Functional residual capacity. Okay? Done. Done. So, yes, the answer is functional residual capacity. Now, regarding the PFTs, pulmonary function test, all are true except, all are correct except. So, look, TLC, total lung capacity increases in emphysema. Emphysematous lungs, big lungs, voluminous lungs. Yeah, lung volumes and capacities increases. Yes, TLC is more. 6 liters, 7 liters, true. Next, residual volume increases in obstructive lung disease. Yes, in obstructive lung disease, emphysema, there is air trapping, there is a more residual volume. True, that's the reason why, see, lung volumes and capacities both increases. Lung volumes and capacities increase in emphysema. True. Next step, FEV₁ is a forced expiratory volume in 1 minute. No, not 1 minute, guys. FEV₁ is the amount of air that you are taking out. The expiration, the maximum expiration in 1 second, definitely not 1 minute. So, definitely this is the except means wrong statement. Okay. Next, a 35-year-old woman present with a complaint of difficulty in inspiration. Stop. The moment you see difficulty in inspiration, we all know inspiratory problem means RLDs, restrictive lung diseases, inspiratory problem. Okay. The doctor suspects sarcoidosis. We all know sarcoidosis is a restrictive lung disease. Okay. There will be the non-caseating granulomas will be seen in the lungs. So, restrictive lung disease, sarcoidosis, RLD. There will be granuloma formation in the lung. Okay. Next up, what FEV₁ by FVC ratios? So, we all know restrictive lung diseases, the FEV₁ by FVC ratios will be normal or even slightly increased. So, what FEV₁ by FVC ratios is likely to be expected by the spirometry study, likely to be determined by the spirometry study. It should be normal or slightly increased. So, what is the near normal value? The near normal value is 0.8 or 0.85 slightly increased. So, this will be the best option. So, with this, you are done, guys. You are done with the topic of obstructive versus restrictive lung diseases and FEV₁ by FVC ratios. Hope the video is helpful. Thank you.